Hello everyone, today we are going to talk about bladder cancer. Being a smoker makes you vulnerable to many diseases and cancers including bladder cancer. If you notice blood in your urine, even if it comes and goes, this might be a sign of a problem with the urinary system. And in the worst cases, it may be a symptom of bladder cancer. And this is what we will talk about. After watching this video, you'll be able to understand everything related to bladder cancer, its symptoms, how it is diagnosed, and the treatments available for it, in addition to its survival rate. Our role today is to answer most of your questions regarding bladder cancer. Today we have Dr. Lee, who is a leading doctor at Ewha Mokdong Hospital. He is going to discuss with us everything about bladder cancer from an experienced medical point of view. Hi, I'm Uma. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good afternoon, Dr. Lee.
Good afternoon.
I am someone who has been practicing bladder surgery for the last 20 and some years. I've been treating invasive bladder cancers that require the whole removal and replacement with an artificial bladder for the last 25 years.
So what are the early symptoms of bladder cancer?
Cancer can happen to any part of the body. If cancer starts in the lungs, it is called lung cancer. If it starts in the liver, it is liver cancer. So cancer that starts in the bladder is called bladder cancer. Unlike other cancers, there is a definitive early symptom. It is bloody urine. Other cancers need a long time to show symptoms. And when the symptoms show, it is often too late. But with bladder cancer, since there is an early clear symptom called hematuria, the early detection rate is 70%.
So what are exactly the risk factors for bladder cancer?
Among the risk factors, the common cause is smoking. Cigarettes are the cause of many cancers. Also for bladder cancer, cigarette smoking is a salient risk factor. Another is hair color dyes, which are yet another risk factor. In hair dyes, a chemical known as aniline dyes are used for coloring but is known to be a potent carcinogen. Professionals that deal with hair dyeing and leather tanning, which deals with petroleum-based chemicals, are also at risk of bladder cancer. In chemotherapy, there is a drug called cyclophosphamide, which also can trigger bladder cancer. There are many causes. Also, during radiation therapy for cancers such as cervical cancers, the exposure to radiation can also trigger bladder cancer.
So is there any ways to prevent bladder cancer?
So if you smoke, stop now. It is very important. We cannot always avoid hair dyes. The exposure needs to be a long time, like 15 to 20 years, which increases the risk 4 to 6 times. So if there are psychological benefits from dyeing hair, I cannot pressure a patient to stop using hair dyes. However, cigarettes must be stopped right away.
So for the diagnosis of bladder cancer, what are the tests?
Okay, we do a urine test during a periodic yearly or biannual exam. When we look at the urine sample, we may not see blood, but with a microscope, we sometimes see blood cells in it. When we see blood cells, we test for bladder cancer to verify. Also, in cases when we see blood clearly, we must certainly undergo endoscopy for determining the presence of bladder cancer. The endoscope is specific for the bladder. It is called a cystoscope. We use the cystoscope to delve into the bladder to see visible signs of cancer. While most think of the endoscope for gastric system, the oldest type is the one for bladder cancer, the cystoscope. We had a cystoscope prior to the invention of electricity. Back when we used cystoscope using a candlelight source to illuminate. That is how old the history of using cystoscopes for bladder cancer is. It is the best tool for diagnosing bladder cancer.
So in the case of diagnosis, afterwards, what are the treatments available for a bladder cancer patient?
Before anything, we must know that there are different types of bladder cancers. Depending on the type of bladder cancer, the treatment can be different. Also, depending on the stage of the cancer, the treatment is also different. For bladder cancers, there are largely speaking 2 different types. Those that have shallow roots and those that have deep roots. For bladder cancers with deep roots, just performing surgery with a cystoscope is not enough. For shallow-rooted bladder cancers, we can simply use a cystoscope and remove the cancer surgically. But for bladder cancers that have a deep root, we cannot simply do that, so we must remove the entire bladder. Until now, we used to wear a bladder pocket to store and dispose of the urine on the side of the patient. But I have been performing a surgery that installs an artificial bladder inside for the last 20-some-odd years in order to allow the patient to urinate naturally. Others would not notice the difference.
So, depending on the stage, there are different kinds of
그래요.
treatments.
Yes, that is true. The question and condition we look for is when we perform surgery for removal of cancer, not only for bladder cancer, but for all cancers, is we must perform the removal surgery when we think we can remove all the tumors. If the cancer has already spread, it is not much help if we simply remove the cancer from the organ. So we can only do the removal surgery if the cancer has not already spread to other parts. If the cancer has spread to the lungs, liver, or bones, it is not much help to remove the cancer from the bladder alone. In such cases, we must use a different treatment such as chemotherapy or radiation, and not surgery. So depending on the stage, the treatment varies.
So, in the case of a patient who did cystectomy, for example, so afterward, or does he have any complications or problems when voiding?
There are many. You mean the neobladder, right? Okay, we must think of the role of the bladder first. When we go to urinate, does the urine just flow on its own? No, we must exert force from the stomach to start the urination, right? The bladder has two roles. One is to store, and the other is to eliminate. Storing requires making a large container, and eliminating requires muscles to contract the bladder, but also force in the stomach. The artificial bladder uses tissue from the colon, and it would not exert discharge on its own, and would need abdominal pressure.
So, talk to us more about advantages of neobladder.
So let's think from the perspective of the patient. Wearing an external urine pouch or living normally with an internal neobladder, what do you think the differences are? There are plenty of differences. First, if we wear a pouch, deformities appear, and we become disabled. Psychologically, we cannot be active and go places. We worry if it would leak, smell, and cannot freely move around to places. And in Korea, we tend to visit the sauna, but with an external pouch we cannot. Also, the same with swimming. Going to the beach, we cannot. Also, we cannot play golf. There are too many activities that we cannot do. There are too many differences.
So, in the case of neobladder, you don't have to suffer from these kind of problems.
Like we said before, we can do all. Go swimming, go to the sauna, play golf. There's not much differences prior to surgery and after. We can do all the normal daily activities, pretty much.
So, talking about neobladder, after getting a neobladder, is sexual life same as before?
In males, erection happens due to nerves which connect to the penis through the prostate. Since during surgery we removed the bladder and prostate, so the nerves are all removed. Erection was impossible. Now the progress in medicine is fast. Even prostatectomy is done by robots. Now we have techniques to save the nerves. I have done more than 1,000 neobladder surgeries, which is worthy of Guinness World Records, as there is no one else who has done 1,000. Due to that experience, I can preserve the nerves during the surgery. So after surgery, my patient can achieve erection.
So other than surgeries, what are the other treatments for bladder cancer?
Besides surgery, for those who are too old and have weak hearts, which would prevent anesthesia, or those over 90 in age, we can help simply by removing some discomforts. We can aim for improvements of life quality until death, even if we do not remove the cancer. If the patient can achieve a better life until death, we do not have to always remove the cancer. So for those who have a limited amount of time left for their life, we do not always reach for the most aggressive form of treatment, such as surgery. We use chemotherapy or radiation conservatively in order to help the patient live a comfortable life during his last few years.
This is my last question. Tell us more about what's special about Ewha Women's University
There are many.
Bladder Cancer Center.
As I said, I have performed over 1,000 surgeries. So the know-how is deep. For example, I started this type of surgery back in 1997, and it used to take me about 10 hours or more. But now, it takes me about 3 hours. Sometimes only 2.5 hours to just 3. As the time required shortens, we can perform more high-risk patients. For example, those with severe diabetes or high blood pressure. There are patients with very limited blood displacement capacity in their hearts, and we can perform the surgery on such patients now. We can take patients who cannot be treated at other hospitals here. We take many such patients, and so far, we do not have any cases of problems even as we took more than 1,000 cases as the time required has shortened a lot. Second, when we do surgery, we use antibiotics, which we use more as the surgery is more significant. While we take only about 3 hours, other places take like 8 hours, so they use huge amounts of antibiotics. But here I do not use antibiotics at all, except for prior to surgery as a preventative measure. I do not use any during the surgery. The benefits are, when I was invited to Europe to speak, Europe is focused on lowering medical costs. Lowering costs by not using antibiotics is not the aim. After surgery, if complications arise, they may not be able to use antibiotics due to the resistance if overused, so they must resort to very powerful ones. But if the surgery was done with minimal antibiotics use, even if later we see complications, we can treat with very inexpensive antibiotics. So the cost difference is quite a lot. So the point is that if not saving costs by not using many antibiotics during surgery, but later if complications arise and we must use very expensive ones. So the Europeans are very interested in learning the techniques to reduce antibiotics use. Also, if antibiotics are not used, the recovery is also very fast, and any necessary treatments are more effective. So not using antibiotics is key. Another is since the surgery is complex, there are like 6 surgical tubes normally coming out of the stomach, etc. But here when we do it, we only have 2. One in the stomach and one in the urinary tract. Just 2. It is very simple and comfortable for the patient when walking during recovery, since there are fewer tubes. So, very comfortable. In natural bladders, urine flows one direction from kidneys to the bladder only, but with artificial ones, urine can backflow. Backflow can carry infections to the kidney. So we invented a method to prevent backflow, which we disclosed in the EU and USA. Also, bowel obstructions can have complications preventing eating for about a month for some. But with our technique, bowel obstructions do not occur, which we also disclosed in EU and USA through a well-known journal of surgery.
So this is a new technique that is used right now?
Yes, indeed.
Thank you so much, Dr. Lee. Today, the doctor explained in details everything related to this lethal cancer and overall survival rate among affected patients. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.